What is the significance of understanding the visual pathways when diagnosing neuro-ophthalmic disorders? Provide examples of conditions that can affect these pathways. Answer: understanding the visual pathways is crucial in diagnosing neuro-ophthalmic disorders because these pathways are responsible for transmitting visual information from the retina to the brain. A breakdown in these pathways can result in specific visual field defects or loss of vision, which can be indicative of underlying neurological conditions. For instance, optic neuritis, which often presents with sudden vision loss and may be associated with multiple sclerosis, primarily affects the optic nerve. In this condition, patients may experience central scotomas or reduced color vision. Papilledema, the swelling of the optic disc due to increased intracranial pressure, can lead to vision loss if left untreated. Furthermore, systemic diseases such as diabetes can cause diabetic retinopathy, which leads to changes in the retinal vasculature and can also affect visual pathways due to ischemia. Key points to remember include the role of imaging studies like MRI in assessing lesions along these pathways and understanding the systemic implications of conditions like hypertension and their ocular manifestations. Discuss the classification of uveitis and the diagnostic approaches used to determine the underlying cause of anterior uveitis. Answer: uveitis is classified into four main types: anterior, intermediate, posterior, and panuveitis based on the anatomical location of the inflammation. Anterior uveitis, the most common form, primarily affects the iris and ciliary body and is often associated with systemic diseases such as ankylosing spondylitis and sarcoidosis. To determine the underlying cause of anterior uveitis, a thorough diagnostic workup is essential. This includes history and physical examination, a detailed patient history to identify possible systemic associations, recent infections or trauma, laboratory tests. These may include ACE or should be typing angiotensin converting enzyme ACE levels for sarcoidosis and serological tests for infections like syphilis and Lyme disease. Imaging studies, ultrasound can be used to assess for complications such as synechia or inflammatory masses. Fluorescein angiography can also help visualize any retinal involvement. Ocular examination. Slit lamp examination is crucial for assessing the degree of anterior chamber inflammation and identifying keratic precipitates. Mr. Smith presents with sudden onset double vision and a drooping eyelid. Upon examination, you suspect a cranial nerve palsy. What steps should you take in managing Mr. Smith's condition, and what potential underlying causes should you consider? Answer: in managing Mr. Smith's condition, the following steps should be undertaken: detailed history and examination, conduct a comprehensive neurological assessment including the extent of diplopia, which cranial nerves are affected, pupil examination to check for relative afferent pupillary defect, and general medical history. Investigate potential causes. Cranial nerve palsies can stem from several underlying causes including vascular issues like diabetes or hypertension, tumors, inflammatory conditions such as multiple sclerosis or trauma. It is essential to consider the most common causes in the appropriate age group and clinical context. Imaging studies, an MRI of the brain and orbits should be performed to rule out space-occupying lesions, particularly if the palsy is isolated or involves the third cranial nerve with pupil involvement. Treatment. Depending on the cause identified, management may include observation for resolution in cases of microvascular palsies, corticosteroids for inflammatory conditions, or surgical intervention for compressive lesions. Follow-up. Regular follow-up to monitor the resolution of symptoms or progression, adjusting treatment as necessary based on the underlying diagnosis. What are the common etiologies of uveitis, and how do they influence the treatment strategies employed? Answer: common etiologies of uveitis include infectious, such as viral, bacterial, or fungal, autoimmune, like Behçet's disease or sarcoidosis, and idiopathic causes. Understanding these underlying causes is essential for tailoring effective treatment strategies. Infectious uveitis. The treatment often involves antimicrobial therapy, antibiotics for bacterial infections, antivirals for viral infections like herpes simplex. In cases of fungal uveitis, antifungal medications are employed. It's crucial to confirm the infectious etiology through laboratory tests before initiating treatment. Autoimmune uveitis. Treatment typically includes corticosteroids to reduce inflammation, often in conjunction with immunosuppressive agents for chronic or severe cases. Regular monitoring of side effects from long-term corticosteroid use is important. Idiopathic uveitis. Management often revolves around symptomatic relief and may require corticosteroids or immunosuppressive therapy based on the severity of inflammation. Diagnostic workup. A thorough evaluation involving imaging studies and laboratory tests is essential to determine the underlying cause, which directly informs treatment decisions. How do systemic diseases like diabetes and hypertension manifest in the ocular system, and what implications do these manifestations have on ophthalmic care? Answer: Systemic diseases such as diabetes and hypertension can have significant ocular manifestations influencing ophthalmic care strategies. Diabetic retinopathy is a leading cause of vision loss among working-age individuals. It typically presents as retinal hemorrhages, exudates, and microaneurysms, leading to complications like macular edema and proliferative diabetic retinopathy (PDR). Regular ophthalmic examinations are essential for early detection and timely intervention, including laser therapy or intravitreal injections of anti-VEGF agents. Hypertension. Hypertensive retinopathy can lead to changes in the retinal vasculature characterized by cotton wool spots, retinal hemorrhages, and retinal vein occlusions. The severity of retinopathy correlates with blood pressure levels and duration of hypertension, necessitating comprehensive blood pressure management as part of ocular care. Implications for care. Regular screenings for diabetic and hypertensive patients are critical. Education on the importance of glycemic and blood pressure control is vital to prevent ocular complications. Collaborating with primary care providers enhances comprehensive care management for these patients. Describe the surgical indications for blepharoplasty and the postoperative care considerations that should be addressed to ensure optimal outcomes. Answer: blepharoplasty, or eyelid surgery, is performed for both functional and aesthetic reasons. Indications include functional indications: excess skin or fat causing visual obstruction, ptosis, drooping eyelids, and eyelid malposition. Patients often present with complaints of fatigue, brow aches, and limited peripheral vision. Aesthetic indications: patients seeking to rejuvenate their appearance by removing excess skin and fat around the eyes, improving eyelid contour, and addressing sagging. Postoperative care considerations: wound care, keeping the surgical site clean and dry, applying prescribed topical ointments, and avoiding sun exposure are crucial to promote healing. Pain management: administering prescribed analgesics and advising the use of cold compresses to reduce swelling and discomfort. Monitoring for complications: patients should be educated on recognizing signs of infection, excessive bleeding, or vision changes that require immediate medical attention. What are the primary factors that influence the choice of immunosuppressive therapy in managing uveitis, and how do these factors correlate with the underlying etiology? Answer: choosing immunosuppressive therapy for managing uveitis depends on several critical factors. Underlying etiology: the cause of uveitis dictates the choice of therapy. For autoimmune conditions, therapies like corticosteroids, methotrexate, or biologics may be indicated. In contrast, infectious uveitis might require targeted antimicrobial therapy. Severity of inflammation: the level of inflammation and the degree of visual impairment influence treatment. Severe, sight-threatening inflammation may necessitate aggressive immunosuppression, while mild cases may be managed with corticosteroids alone. Patient systemic health: the patient's overall health status, including the presence of comorbidities and their ability to tolerate certain medications, is crucial. For instance, patients with renal impairment may require modifications in drug choice or dosing. Risk of complications: the potential side effects of immunosuppressive therapy, such as increased infection risk or organ toxicity, must be weighed against the benefits. Regular monitoring for adverse effects is essential. Patient preference: shared decision-making with the patient about treatment options, potential side effects, and expected outcomes is vital for adherence and overall satisfaction with the management plan. In the context of ocular surgery, what are the essential preoperative assessments that should be conducted to minimize risks and ensure patient safety? Answer: essential preoperative assessments in ocular surgery include comprehensive ocular examination, assess visual acuity, intraocular pressure, and peripheral vision, examine the anterior and posterior segments to identify any pre-existing conditions that could affect surgical outcomes, medical history review, thorough evaluation of the patient's medical history, including systemic conditions, e.g. diabetes, hypertension, medication use, and previous ocular surgeries, to assess risk factors for complications. Allergy assessment: document any allergies, particularly to anesthetics or topical medications, to avoid adverse reactions during surgery. Laboratory tests: depending on the patient's age and medical history, preoperative blood tests, such as complete blood count and coagulation profile, may be indicated to assess overall health and bleeding risk. Informed consent: educating the patient about the procedure, potential risks, benefits, and alternatives, ensuring that they provide informed consent based on a thorough understanding. Anesthesia evaluation: consult with an anesthesiologist if general anesthesia is required, particularly for patients with significant comorbidities. Explain the role of corticosteroids in the management of uveitis and the potential complications associated with their long-term use. Answer: corticosteroids play a pivotal role in the management of uveitis due to their potent anti-inflammatory effects. They are used in various formulations, including topical eye drops, systemic, oral, or injectable, and periocular injections around the eye routes depending on the severity and location of inflammation. Indications for use: acute uveitis. Corticosteroids help control inflammation rapidly and are often the first line of treatment. Chronic uveitis. Long-term use may be necessary in chronic conditions or when other immunosuppressive therapies are inadequate. Potential complications of long-term use. Ocular complications. These may include increased intraocular pressure, leading to glaucoma, cataract formation, and potential damage to the optic nerve. Systemic complications. Long-term corticosteroid use can result in systemic side effects such as osteoporosis, adrenal suppression, weight gain, and increased risk of infections. Monitoring requirements. Regular ophthalmic evaluations to assess for changes in IOP and cataract development are essential in patients receiving long-term corticosteroid therapy. Discuss the surgical considerations and potential complications associated with orbital surgery for thyroid eye disease. Answer: orbital surgery for thyroid eye disease (TED) is indicated for patients with significant proptosis, optic nerve compression, or cosmetic concerns. The surgical approach may involve orbital decompression, strabismus surgery, or eyelid surgery. Surgical considerations. Preoperative evaluation. A thorough assessment of the patient's visual function, degree of proptosis, and overall health status is crucial. Imaging studies, CT or MRI, are often performed to plan the surgical approach and evaluate orbital anatomy. Surgical technique. The choice of approach, transantral, transconjunctival, or lateral orbitotomy, depends on the desired outcome and the specific anatomical considerations. Surgeons must be adept at recognizing and preserving critical structures, such as the optic nerve and extraocular muscles. Potential complications. Immediate complications. These may include bleeding, infection, or intraoperative injury to the optic nerve or muscles. Late complications. Patients may experience persistent diplopia, dry eye syndrome, or changes in eyelid position. Additionally, recurrence of TED symptoms can occur. Patient counseling. It is essential to counsel patients regarding the risks and benefits of surgery and post-operative expectations, including potential need for further interventions. By addressing these considerations and complications, surgeons can optimize outcomes and minimize risks in managing thyroid eye disease. What are the primary mechanisms of action for beta blockers in the treatment of glaucoma, and what are their systemic side effects? Answer: beta blockers, such as timolol, are primarily used to manage intraocular pressure in glaucoma patients by decreasing aqueous humor production. They act on beta-adrenergic receptors in the ciliary body, inhibiting the enzyme adenylate cyclase, which subsequently reduces the formation of cyclic AMP CAMP. This reduction in CAMP leads to decreased secretion of aqueous humor, thus lowering IOP. Systemic side effects. Common systemic side effects include bradycardia, hypotension, and respiratory issues such as bronchospasm, particularly in patients with a history of asthma or chronic obstructive pulmonary disease (COPD). Due to potential absorption into the systemic circulation, clinicians must monitor patients, especially those with pre-existing conditions that could exacerbate these side effects. Describe the pharmacokinetics of ocular medications and how these factors influence their clinical efficacy. Answer: pharmacokinetics in ocular pharmacology involves the absorption, distribution, metabolism, and excretion of drugs used in ophthalmic treatments. Absorption. Ocular medications can be absorbed through various routes, including the cornea, conjunctiva, and systemic circulation. Bioavailability can be affected by tear turnover and drainage. For example, the typical tear turnover rate limits the time that topically applied medications have contact with the ocular surface. Distribution. After absorption, drugs distribute to various ocular tissues such as the anterior chamber and retina. Factors influencing distribution include lipophilicity and molecular weight of the drug, metabolism and excretion. Ocular medications may undergo local metabolism in the eye or systemic metabolism once absorbed. Understanding these processes is essential for predicting drug efficacy and potential toxicity. Overall, the pharmacokinetic properties determine the dosing frequency, formulation choice, and patient adherence strategies to optimize therapeutic outcomes. Explain the indications and contraindications for using topical versus systemic corticosteroids in ocular conditions. Answer: topical corticosteroids. Indications: topical corticosteroids G. Prednisolone are indicated for localized inflammatory conditions such as conjunctivitis, anterior uveitis, and corneal inflammation. Contraindications: they are contraindicated in cases of ocular infections unless there is a concurrent appropriate antimicrobial therapy, as they can exacerbate infections. Additionally, in patients with glaucoma, prolonged use may increase IOP. Systemic corticosteroids. Indications: systemic corticosteroids are utilized for more severe or generalized inflammatory conditions, e.g. systemic lupus erythematosus, with ocular involvement. Contraindications: they may be contraindicated in patients with active infections, uncontrolled diabetes, or certain psychiatric disorders due to the risk of exacerbating these conditions. Moreover, they require careful monitoring for potential side effects like hypertension and increased blood glucose levels. What are the primary ocular side effects associated with the use of prostaglandin analogues in glaucoma management? Answer: prostaglandin analogues, such as latanoprost, are commonly prescribed for glaucoma because they enhance aqueous humor outflow. However, their use can lead to several ocular side effects. Hyperemia: increased blood flow can cause redness of the conjunctiva. Iris color change: prolonged use can lead to increased pigmentation of the iris, particularly in individuals with hazel or light-colored eyes. Eyelash changes: patients may notice longer, thicker eyelashes. Ocular inflammation: some individuals may experience a foreign body sensation or mild irritation. It is essential for practitioners to inform patients about these potential side effects and to monitor them regularly. Mr. Johnson, a 65-year-old male with a history of asthma, is prescribed timolol for his newly diagnosed open-angle glaucoma. During his follow-up visit, he reports experiencing increased wheezing. What should Mr. Johnson and his ophthalmologist discuss regarding his medication regimen? Answer: Mr. Johnson's report of increased wheezing raises concerns regarding the use of timolol, a non-selective beta blocker that can exacerbate bronchospastic diseases such as asthma. The ophthalmologist should evaluate medication efficacy, assess the effectiveness of timolol in managing Mr. Johnson's intraocular pressure, consider alternatives. Discuss switching to selective beta blocker or alternative classes of glaucoma medications, such as prostaglandin analogues, which may be less likely to induce bronchospasm. Monitor respiratory status. Collaborate with Mr. Johnson's primary care provider to ensure his asthma is adequately managed during the changing glaucoma therapy. Educate on symptoms. Instruct Mr. Johnson on recognizing worsening asthma symptoms and the importance of seeking prompt medical attention if his condition deteriorates. How does the bioavailability of ocular medications impact the choice of treatment for patients with glaucoma? Answer: bioavailability of ocular medications refers to the proportion of the drug that reaches systemic circulation and the targeted ocular tissues effectively. In glaucoma management, low bioavailability of topically applied medications, often less than 5%, means frequent dosing is necessary to maintain therapeutic levels. Formulation choices: clinicians may opt for formulations with enhanced bioavailability, such as gel or sustained-release implants, to improve adherence and efficacy. Impact on efficacy: low bioavailability can lead to suboptimal intraocular pressure control, prompting the need for alternative therapies or combination treatments to achieve desired outcomes. By understanding these pharmacokinetic principles, practitioners can make informed decisions about the most appropriate glaucoma management strategies. What is the role of patient education in minimizing the adverse effects of ocular medications? Answer: patient education is crucial in optimizing the therapeutic outcomes of ocular medications and minimizing adverse effects. Key aspects include administration techniques, educating patients on proper techniques for instilling eye drops, e.g., avoiding touching the dropper to the eye can prevent contamination and enhance absorption. Adherence to treatment regimens, reinforcing the importance of adhering to prescribed dosages and schedules to prevent fluctuations in IOP and avoid potential complications. Awareness of side effects, informing patients about common and serious side effects, encouraging them to report any unusual symptoms promptly, e.g., signs of an allergic reaction or systemic absorption effects. Lifestyle considerations, advising on the importance of regular follow-ups and lifestyle modifications that could support treatment effectiveness, such as dietary changes and managing comorbid conditions. Discuss the differences in mechanism and therapeutic use between NSAIDs and corticosteroids in the treatment of ocular inflammation. Answer: NSAIDs, e.g. ketorolac. Mechanism of action: NSAIDs work by inhibiting cyclooxygenase (COX) enzymes, leading to decreased production of prostaglandins, which mediate inflammation and pain. Therapeutic use: They are primarily used for pain relief and management of mild to moderate inflammation, such as in allergic conjunctivitis or postoperative inflammation. Corticosteroids, e.g., prednisolone. Mechanism of action: corticosteroids suppress inflammation by inhibiting multiple inflammatory pathways, including the transcription of inflammatory cytokines. Therapeutic use: they are indicated for more severe inflammatory conditions such as uveitis and severe allergic reactions. However, they carry a risk of increased IOP and cataract formation with prolonged use. Understanding these distinctions helps clinicians choose the appropriate anti-inflammatory therapy based on the severity and type of ocular condition being treated. What factors influence the choice between topical and systemic antibiotics in managing ocular infections? Answer: when determining whether to use topical or systemic antibiotics for ocular infections, clinicians consider several factors. Severity and location of infection. Topical antibiotics are usually sufficient for localized infections, e.g., bacterial conjunctivitis, while systemic antibiotics may be necessary for severe or deeper infections, e.g., orbital cellulitis. Patient's health status. Consideration of the patient's overall health, including any systemic conditions, e.g., renal impairment, that could affect drug metabolism and excretion. Risk of resistance. The potential for developing antibiotic resistance can influence the choice. Clinicians may opt for topical administration to minimize systemic exposure and resistance development. Side effect profile. Topical antibiotics generally have fewer systemic side effects, making them preferable for patients with pre-existing conditions that may exacerbate with systemic treatment. Analyze how drug interactions might impact the treatment plan for a patient receiving glaucoma medications. Answer: drug interactions can significantly impact the safety and efficacy of glaucoma treatments. Clinicians must consider concurrent medications. For instance, systemic beta blockers can interact with oral antihypertensives, leading to additive effects on blood pressure. This necessitates careful monitoring and possible adjustment of dosages. Pharmacokinetic interactions. Medications that affect liver enzymes, the GCYP inhibitors, can alter the metabolism of glaucoma drugs, potentially leading to increased systemic exposure and heightened risk of adverse effects. Patient compliance. Educating patients on potential interactions, e.g., over-the-counter medications and supplements, can help maintain adherence and optimize therapeutic outcomes. By understanding the implications of drug interactions, healthcare providers can tailor treatment plans to ensure patient safety and improve overall effectiveness in managing glaucoma. Describe how the teach-back method can enhance patient understanding and retention of medical information in ophthalmology. Include specific techniques a physician might use to implement this method effectively. Answer: the teach-back method is a communication technique used to confirm that patients understand the information provided to them. In ophthalmology, where patients may receive complex information about their health, the following steps can be employed. Simplify information, use layman's terms and avoid medical jargon. For instance, when discussing glaucoma, a physician might explain, "This condition means the pressure in your eye is higher than normal, which can harm your vision over time." Ask for retelling. After providing information, the physician should ask the patient to explain it back in their own words. For example, "Can you tell me what you understand about how to take your eye drops?" Use visual aids. Incorporating diagrams or charts can help patients visualize their condition and treatment. A simple diagram illustrating the anatomy of the eye can enhance comprehension. Encourage questions. Create an environment where patients feel comfortable asking questions. The physician might say, "What concerns do you have about your treatment plan?" Discuss the ethical implications of resource allocation in ophthalmology, particularly in underserved populations. How can ophthalmologists navigate these challenges while ensuring equitable access to care? Answer: resource allocation in ophthalmology raises significant ethical dilemmas, particularly in underserved populations where access to care may be limited. Key considerations include equitable access. Ophthalmologists must advocate for fair distribution of healthcare resources, which may involve providing services at reduced costs or through community outreach programs to ensure that disadvantaged groups receive necessary eye care. Prioritization of care. Clinicians often face difficult decisions regarding which patients to prioritize, especially when resources are limited. Using clinical guidelines and criteria, they should assess patient needs based on urgency and potential outcomes. Advocacy and policy change. Ophthalmologists can participate in health policy discussions to address systemic inequalities that affect access to eye care. This may include advocating for funding increases for community health initiatives focused on eye health. Cultural sensitivity. Understanding the unique barriers faced by different populations, such as language differences or cultural beliefs about healthcare, can help tailor approaches to care. Ophthalmologists should strive to provide culturally competent care that respects diverse backgrounds. Mr. Thompson, a 72-year-old man with advanced macular degeneration, is struggling with the emotional toll of his deteriorating vision. During a follow-up visit, he expresses a desire to forego further treatment and enter palliative care, believing that his quality of life has diminished significantly. As his ophthalmologist, how should you approach this conversation and what ethical considerations must you keep in mind? Answer: when addressing Mr. Thompson's request to consider palliative care, the ophthalmologist should approach the conversation with compassion and sensitivity. Key steps include creating a supportive environment. Ensure the conversation takes place in a private, comfortable setting where Mr. Thompson feels safe expressing his feelings. Active listening. Demonstrate empathy by actively listening to Mr. Thompson's concerns and acknowledging his feelings about his vision loss. Validate his experiences and allow him to share his perspective fully. Discussing options. Clearly explain the potential benefits and limitations of continued treatment versus palliative care. Ensure Mr. Thompson understands that his wishes are paramount and that exploring his options is part of a shared decision-making process. Informed consent. Confirm that Mr. Thompson understands all information regarding his condition and treatment options. Ethical principles. Uphold the principles of autonomy, beneficence, and non-maleficence. Respect Mr. Thompson's autonomy by supporting his decision-making while also considering the ethical implications of recommending or discouraging certain treatments. What strategies can an ophthalmologist use to effectively deliver bad news about a diagnosis of a severe eye condition, ensuring that the patient understands the implications and feels supported throughout the process? Answer: delivering bad news, such as a diagnosis of a severe eye condition like retinal detachment, requires careful consideration and communication strategies. Prepare the environment. Choose a quiet and private setting for the conversation to minimize distractions and allow the patient to process the information. Use clear language. Explain the diagnosis using straightforward language, avoiding jargon. For instance, your retina, the part of your eye that sends signals to your brain, is damaged. This could lead to significant vision loss if not treated. Empathy and compassion. Show understanding of the emotional impact this news may have on the patient. Acknowledge their feelings by saying, "I understand this is difficult to hear." Allow for emotional reactions. Give the patient space to express their emotions. Allowing for silence can provide them with the opportunity to reflect on the news. Provide information on next steps. After delivering the diagnosis, outline the available treatment options, timelines, and what the patient can expect moving forward. Encourage questions. Invite the patient to ask questions to ensure they fully understand the diagnosis and treatment options. How can ophthalmologists enhance their cultural competency to improve patient interactions and outcomes in a diverse patient population? Provide specific examples of strategies that can be implemented. Answer: enhancing cultural competency is crucial for ophthalmologists to effectively communicate with and treat diverse patient populations. Strategies include cultural awareness training. Participate in workshops and training programs that focus on understanding different cultural practices, beliefs, and health behaviors. This knowledge helps practitioners tailor their approach to individual patients. Adapting communication styles. Recognize that patients may have varying preferences for communication. For instance, some cultures value direct communication, while others may prefer a more indirect approach. Tailoring communication can improve rapport and understanding. Using professional interpreters. When language barriers exist, using qualified interpreters ensures accurate communication. Avoid using family members for translation, as this can lead to misunderstandings and breaches of confidentiality. Developing educational materials. Create culturally relevant educational materials that reflect the languages and customs of the patient population served. Building trust. Foster relationships with community leaders or organizations to better understand the needs of diverse populations. What are the key components of the informed consent process in ophthalmology, and how can physicians ensure that patients truly understand the risks and benefits of proposed treatments? Answer: the informed consent process in ophthalmology is vital for ensuring that patients make informed decisions regarding their care. Key components include disclosure of information. Physicians must provide comprehensive information about the diagnosis, the nature of proposed treatments, potential risks and benefits, and any alternatives available. For example, in cataract surgery, the risks of complications like infection or vision impairment must be clearly articulated. Comprehension. To ensure that patients understand the information, physicians can use the teach-back method, asking patients to repeat back their understanding of the information. This confirms that the patient has grasped the essential details. Voluntariness. Patients should make decisions without coercion. Physicians must ensure that patients feel free to ask questions and express concerns about their treatment options. Competence. Assessing the patient's ability to comprehend the information and make decisions is critical. If there are concerns about a patient's competency involving family members or seeking a mental health consultation may be necessary. Documentation. Documenting the informed consent process is essential, including what information was provided and how the patient responded. In the context of ophthalmology, what ethical challenges arise in end-of-life decisions, particularly regarding patients with irreversible vision loss? How should ophthalmologists approach these discussions? Answer. Ethical challenges in end-of-life decisions for patients with irreversible vision loss require careful navigation. Key challenges include assessing quality of life. Ophthalmologists must evaluate how vision impairment affects the patient's overall quality of life. This assessment is subjective and may vary significantly among patients. Discussing palliative care. When patients express a desire to stop curative treatment, it is essential to introduce the option of palliative care. Sensitively. Explain how palliative care focuses on comfort and quality of life rather than curative measures. Respecting autonomy. Upholding the patient's right to make decisions about their care is crucial. This involves listening to their wishes regarding the continuation or cessation of treatment. Navigating family dynamics. Family members may have differing opinions about the patient's treatment. It is important to facilitate discussions among family members while respecting the patient's autonomy. Ethical principles. Apply ethical principles such as beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and justice, ensuring fair treatment when guiding these discussions. Explain the significance of maintaining patient confidentiality in ophthalmology and the implications of breaching this ethical obligation. What steps can ophthalmologists take to ensure compliance with HIPAA regulations? Answer. Maintaining patient confidentiality is a cornerstone of ethical medical practice in ophthalmology. The significance and implications include trust and rapport. Upholding confidentiality fosters trust between patients and ophthalmologists, encouraging open communication about sensitive health issues. Legal obligations. Breaching confidentiality can lead to legal consequences, including lawsuits and disciplinary actions by medical boards. Under HIPAA, Health Insurance Portability and Accountability Act, patients have the right to privacy regarding their health information. Protecting sensitive information. Ophthalmologists often handle sensitive data, such as diagnoses related to vision impairment, which can significantly impact a patient's life. Protecting this information is crucial to maintaining the patient's dignity and autonomy. Implementing security measures. To ensure compliance with HIPAA regulations, ophthalmologists should limit access to patient records to authorized personnel only. Use secure methods for transmitting patient information, such as encrypted emails. Provide regular training to staff on confidentiality policies and HIPAA compliance. Conducting risk assessments. Regularly assess the practices, policies, and procedures regarding patient confidentiality and data security. This proactive approach helps identify potential vulnerabilities and mitigate risks. By prioritizing patient confidentiality and adhering to HIPAA regulations, ophthalmologists can protect patient rights and maintain professional integrity. Discuss the role of active listening in building rapport with patients in ophthalmology. What techniques can ophthalmologists employ to enhance their listening skills and improve patient interactions? Answer. Active listening is essential for building rapport with patients in ophthalmology, as it fosters trust and understanding. Techniques to enhance active listening include reflective listening. Paraphrase what the patient has said to demonstrate understanding. For example, so you're saying that the glare from lights is particularly bothersome to you. Is that correct? Nonverbal cues. Use body language such as nodding, maintaining eye contact, and leaning slightly forward to show attentiveness and engagement. Open-ended questions. Encourage patients to share their concerns and experiences by asking open-ended questions such as, can you tell me more about how your vision changes affect your daily activities? Summarizing information. After the patient shares information, summarize key points to clarify understanding. This also provides an opportunity to address any misconceptions. Creating a comfortable environment. Ensure that the consultation room is inviting and private, which can help patients feel at ease when discussing their concerns. How can ophthalmologists effectively use visual aids to enhance patient education regarding complex medical conditions? Provide examples of effective visual aids that can facilitate understanding. Answer: visual aids can significantly enhance patient education by making complex medical information more accessible. Effective use of visual aids includes diagrams and charts. Utilize anatomical diagrams to explain conditions such as diabetic retinopathy. A labeled diagram can help patients understand where the damage occurs and how it affects vision. Infographics. Create infographics that summarize key information about a condition, treatment options, and potential outcomes. Infographics can convey a lot of information quickly and clearly. Videos and animations. Short videos demonstrating surgical procedures or the effects of eye diseases can help patients visualize the concepts. For example, an animation showing how cataract surgery is performed can alleviate patient anxiety about the procedure. Models and 3D objects. Using physical models of the eye can provide hands-on learning opportunities for patients, allowing them to explore the anatomy and understand how their condition affects vision. Patient handouts. Develop handouts that combine written explanations with images or illustrations.